My name's Sharon Curtin, and this presentation is about effective communication to support behaviour change. So a little bit about me. I worked for a number of years in a clinical role as a dietitian, and in that time I worked in the hospital system, so with inpatients and outpatients, and I also did a lot of diabetes clinics. And I loved it. It was really rewarding. I particularly loved providing information and education, and I really loved that I was helping people. But the thing is, when it comes to behaviour change, it's quite frustrating. So there were so many times that you were trying to help your clients to change their behaviour, be healthier, change something in their lifestyle, and they really struggled. And I was frustrated. Often they knew what to do, or they'd seen many dietitians before me. And in fact, they even knew that it was important for their health to change, but they still didn't seem to be taking action. And I had education in my little toolkit, but what else? I was frustrated with what I was able to provide them with and how I could help them. And when we think about it, we've got a traditional medical approach, and it's fantastic if you've got an acute condition, if you need a diagnosis. There's diagnostic tests that you can have. You can be prescribed medication. So if you're newly diagnosed with a medical condition, or you just have something acute going on and you need a treatment plan, our traditional medical approach is fantastic. However, it's not designed to equip our clients with behaviour change strategies, and it doesn't empower our clients to manage their own health. And I often found that the clients seemed quite passive, and I felt like I was either trying to push them or pull them towards change. Then I learned about the behaviour change approach, which is health coaching. It's client-centred, it supports our clients by giving them behaviour change techniques. It promotes self-efficacy, which is a belief that we can do it. Self-determination, which is our right to have our own lives and to make our own decisions, as well as self-responsibility. It's not prescriptive and it doesn't diagnose. So in this presentation, I'm going to be talking about one of the foundation skills of behaviour change, which is communication. I'm going to talk about listening on purpose for motivation and obstacles, how we can use open-ended questioning to be more effective, how we can reflect and summarise as a way of showing understanding, how we can affirm strengths and our clients' efforts, and it's also going to be telling you about the programs that are offered by Accredited Health Coaching Australia. So you're in the right place if your clients would benefit from healthier lifestyle behaviours but struggle to change. And you'd like to be more effective at helping your clients achieve their health goals. And also you're willing to adapt your communication to help your clients harness their motivations and strengths. So how do we listen? If you think about a typical client consultation, it's often centred around the exchange of information. We ask questions and listen to the answers, and it's all about finding out what we as the health practitioner needs so that we can help. And often there's an assumption of what we think our clients are there for. We filter all of this information through what's important to us, what or why we need to know it, our own experiences, our own beliefs, both about the client and about the behaviour that needs to be changed. So when I think back to being a dietitian, a typical consultation was connecting, establishing a rapport, exchanging information, asking questions, collecting information, listening to the answers. Then I'd share some information or education and come up with a plan or some ideas or suggestions. Sometimes my clients would leave with 20 dot points of things they could do, and sometimes they would look completely overwhelmed, and I'd be like, oh, just try these 2 things. Either way, I was setting the agenda for what happened in that session. But really, do we ever think about what exactly do our clients need? And why have they come to us? Your answer might be, well, for our expert advice, so that we can help them, so we can fix them. Actually, our clients come to us to be heard and to be understood. Brené Brown has got a fantastic quote, which is, be as passionate about listening as you are about being heard. And in all those years of giving fantastic education and advice, I was more about being heard and I was less about listening. So a way that we can help our clients to feel understood is by active listening. And active listening is when we listen on purpose. So in fact, we're not listening for, their facts, how long they've had their medical condition and what type of medication they're on and what they're doing. We're actually working on developing a really deep understanding of where our clients at. We're considering their experience, their values, and their strengths. And when you're practicing active listening, you're actually listening for clues about their barriers and about the importance of change. You're also listening for those non-verbal cues. What's their body language doing? Are their arms crossed? Do they feel engaged with what you're saying, or would you say they're more disengaged? When we're practicing active listening, we're asking open-ended questions that evoke self-discovery. We're allowing silence. We reflect and summarise, which is our way of showing that we understand our client and we're on the same page. And we're also using our active listening to affirm strengths and learnings. A way that we can help our clients to feel heard and understood is by active listening. And active listening is all about listening on purpose. We're not just listening for answers and facts about medical conditions or how often they exercise. We're listening for clues about the barriers that are holding our client back and the reasons that change is important. We're listening for the non-verbal clues, like their eyes are glazed over or their arms are crossed. Maybe they appear a little disengaged. We're asking open-ended questions that evoke reasons to change and self-discovery. And we're allowing silence. We're reflecting and summarising to show understanding, and we're affirming strengths and learnings. These are known in motivational interviewing as the OARs: open-ended questions, affirmations, reflections, and summaries. Now, these are called micro-counselling skills and are used by many different types of counselling techniques. However, if you've done any motivational interviewing, you would have been introduced to them as the OARs. So we're all great at asking questions, but it's actually about asking the right questions. Questions that get your client thinking. What do they want? What's important to them? What makes change worthwhile? When we use effective questions, we can help our clients connect the dots between their actions or behaviour and getting something that they value. Effective questions will start with what, who, or how. They're always open questions. We're wanting to gather insight, not information. We want our clients to learn about their values and get clear about their goals. We don't tend to use why. Why don't you exercise? Why don't you like to eat vegetables? It can feel a bit judgmental and our clients can get defensive. Now you know you're doing this right and you're using good open-ended questions when your client starts to do more talking than you. And one thing that we're really wanting to discover from our open questions is motivation, or our motive. When we use effective questions, we can actually help our client to uncover their why, their own compelling reasons to change. Because essentially, if something's important to us, we're going to do it. And in general, the things that motivate us are linked to the things that we value. So we assume that our clients value health just because we do. It may not be the case. They might not value health at all. They might value being a role model to their children. They might value time. So anything that's going to get them the result in the quickest way and save them time and be efficient is really what they value. They might value freedom. They don't want to be restricted. They just want it to be easy so that they can just do what they like and have freedom. They might value aesthetics, treating their body with respect and appreciating the results might be something that actually motivates them. And a really great question is, what will get you out of bed at 6 a.m? If they're going to be going to the gym, they're going to be going for that walk. What's the thing? What's the thought? What can they focus on that when they think about it, they're going to jump out of bed and go for that walk or that run? So some open questions that can help our clients to evoke their reasons for change, their motivation. Well, one of them is just tell me more about that, and then they'll talk about why they're wanting to change their behaviour. We might also say, well, what does healthy look like? Is it important to you to get your diabetes under control? What's important to you about starting to exercise? What are some possible advantages of cutting down your alcohol intake? What difference would it make if you did go to bed earlier? And how would you know it was time to change? How would you feel if you did make the change? How would it make your life better or different? And how are the current ways or behaviours not working for you? Asking these questions will get your clients starting to talk about all the reasons that change is personally important to them. We can also ask open questions to discover more about the barriers that are holding our clients back and the strengths that they can possibly use to make their goals possible. What are you doing well? What went well? What have you learnt? How did you succeed last time? What do you consider to be your strengths? Tell me some things you do already to look after your health. Tell me about something you're really proud of. How did you accomplish it? How can you use the strengths in this scenario? Asking them about what's getting in the way, why they're stuck, will give you more of an understanding about what is holding them back from change. Whereas asking them about their strengths and the ways that they succeed at other behaviours can help them to feel more confident about change. Another one of the O's is affirming. So an affirmation is a positive statement regarding one's character or values that acknowledges his or her strengths and efforts. And that's from Miller and Rolnick. So an affirmation is in fact a complex reflection. It helps to build rapport, it validates and supports the client, and it helps to build self-efficacy, which is a belief that they have what it takes to change. It encourages persistence. It can be a statement of appreciation and understanding. It's when strengths and efforts for change are noticed. And it helps a client to internalise a positive belief in themselves. So think for a moment about how you encourage a client. Quite often, if a client's had a great week, we say, well done, I think that's fantastic, I'm proud of you. And then if they've had a bad week, we try to make it better. I know you can do better next time. I'm sure that next week will be better for you. But actually, becoming a cheerleader and giving praise and compliments is in fact not helpful. It starts to motivate clients to take action for us, for our praise and approval. So we need to know the difference between affirming and giving praise. Although we absolutely want to encourage the client and build their confidence, we need to make sure that the affirmation is about the client and not us. Because the goal is we want the client to be internally motivated and to be reliant on themselves and not on us. So when we express our approval of the client or their actions, I think it's great. That's praise. And these statements take ownership of the client's results. I'm proud of you, I'm impressed, or I think you've done well this week. That's about us. And it shifts the emphasis to an external motivator, which is our approval. And this can erode confidence and autonomy. Affirmation, though, is about the client, and the client gets to affirm themselves and their actions or efforts. So when we say, you've done really well, they go, yeah, I have. Or you've tried really hard. I did try hard. I tried really hard this week. Or you've really thought about this. Yeah, I have. I think a lot about things. I've really thought it through. So when we express an affirmation, the client then self-affirms. And the focus is either on the client, the process, the effort that they've taken, or the strengths that they've demonstrated. And it really helps the client to see themselves in a positive light. This in itself is very empowering. We want to help our clients connect to their progress and their accomplishments, their strengths and their abilities, and even their previous success in similar situations. So we can use affirming to help them acknowledge just how much progress they've made. It increases their confidence and builds their self-efficacy or their belief that they can do it. So how do you affirm? First of all, you look for a positive angle. It might be a strength you've noticed. It might be some progress they've made, no matter how small. It might be something that they really value that you've just heard them say. And then you highlight it, starting with the word you. So instead of I'm so proud of you, it's you must be proud. You really care about being a role model. You know what matters to you. You've learned to trust yourself. You hit a roadblock, but you kept going. And you put your mind to something and you do it. They will self-affirm to those statements. Yeah, I really do care about being a good role model. You know what? I have learned to trust myself. Yes, I did hit a roadblock, but I did keep going. All of a sudden, the energy changes. They've gone from feeling negative and that they haven't done very well to all of a sudden seeing that there was something good in what they did. Now we're going to look at reflecting and summarising. So we've done the O, we've done the A. We're now going to do the R and the S of the ORs. Reflections are when we reflect back at a client what we hear them say. So think of it like shining a mirror. So their words bounce off that mirror and back at them. A simple reflection is when we repeat or slightly rephrase what the client says. So we might use their exact words. They might say, oh gosh, it's been a big week. And we might reflect, it's been a big week. Or we might slightly change it. So we might say, you've been really busy, if that was the context of what they were telling us. A complex reflection is the next level. A complex reflection reads between the lines. And it kind of interprets what the feeling or the emotion of what the client is saying, and then that is the statement that you reflect back. So they might be talking about that they were really busy and that they had so much on and it's just been a crazy week, and your reflection might be, it's been overwhelming. Now they might not have said the word overwhelming, but that was definitely the essence of what they were telling you. A double-sided reflection can be two simple reflections that are strung together, or it can be more of a complex reflection. But either way, it's called double-sided because you essentially reflect the positive and the negative arguments for change. On one hand, you're tired, and on the other hand, exercise is important to you. So you reflect the two arguments that you've heard them say back at them. A metaphor can also be a way of reflecting, which is, they tell you how overwhelmed and busy they've been, and you might say, it's like you've been driving around with your petrol light on. So that's a metaphor that really captures, in a visual way, what they've been telling you. When we reflect our clients' words, thoughts and feelings, it really shows that we're listening, and it allows a shared understanding without even needing to ask a question. Our clients feel that we're really hearing them and we get them. When we reflect our clients' words back to them, they get to hear what they've just said repeated back. And when they hear it, they get a chance to evaluate whether or not that's true. And we can clarify any misinterpretation of the way that we've taken their information or what they've just said. And then it can also move the conversation forward. So when someone feels you have heard them and understood them, they're happy to move on. Otherwise, they may repeat themselves. They might go back into the story and then tell you the same thing again. When you start to use reflections more than questions, you don't start the conversation. As your client's talking, you reflect what they've said, and they say, yes, that's it. And then they keep moving. And the conversation goes to new depths versus them saying something and then you asking a question. When that happens, you take the conversation in the direction that you decide rather letting them tell the story in their own way. It's funny, but when you reflect, you can get a lot of information quite quickly. And in fact, sometimes clients come to their own realizations just by hearing their own arguments for change, particularly when you reflect these arguments for change back to them. So the way we reflect is quite strategic. We listen for things that are important to them. We listen for their reasons to change, and then we reflect them back. So if someone said to you, I'd like to exercise, but I don't have the time, work's really full on right now. You've got a couple of choices. You could reflect, you're too busy to exercise. And all you're doing is reinforcing how busy they are. You could also reflect, your workload doesn't leave you any time to exercise. So a bit more of a bigger reflection, still focusing on the negative of them not having time. However, if we use a double-sided reflection, we could say, you've got a lot on your plate and you'd really like to exercise. So we've just used that mirror to reflect back their two reasons, one for change and one to stay the same. And you'll notice that we start with the reason to stay the same and we finish with the reason to change. So I'd like to get up in the morning earlier, but I'm just so tired. We can say, you're really tired. Getting up early is hard. Both of those is reinforcing the it's too hard story. Or we could focus on the reason to change. Getting up earlier is important to you. Now, reflections are really hard to get your head around when you first start. It's important to remember they're statements, not questions. So if they've been just so tired in the morning, you're tired in the morning? It becomes a question. So when you're first starting out with reflections, the worst thing that you can do is feel like you're being condescending. And the funny thing about reflections is you might feel that it's a bit strange for you, but in fact it's really nice to repeat things back to someone and have them feel heard. You can start off with, so you feel like exercise is important to you. It sounds like you really do want to go to bed earlier. It seems that even though you're busy, you're really keen to find ways to fit in meal planning. What I hear you saying is that this area of health is going to make a real difference if you can get on top of it. You're wondering if it's worth the effort. So over time, you will pick up on keywords to repeat, and you'll get better and better with practice. So don't give up with reflections. It's such an easy trap to fall into question asking. Whereas when you just start reflecting a client's words back to them and the essence of what they've been saying, you will actually notice there is more connection, and in fact you get much more deep, valuable information from your client. So summaries are a type of reflection. In fact, they're a group of reflections. So as your client's talking, you pick up the key points of what they're saying, like a flower. Picking up a flower, picking up another flower, picking up another flower. And then you bunch all of those reflections together and you present the bouquet of flowers back to the client for them to have a look at. It's really good for clarifying your understanding of the discussion so far. And it's also a really good way of pointing out where there's been a discrepancy between your client's goal and the current behaviour or the current situation. Importantly, it demonstrates that we're listening and that we understand the perspective of our client. It's a great way of checking in and clarifying that you're actually on the same page. And in fact, when you present that bunch of flowers back to your client, those key points that you've picked up of what they've said, and they hear those key points back, it helps them to organise their thoughts and feelings. So, it sounds like when you were first diagnosed, you had a great routine and you were really motivated to exercise. But when you hurt your back, some old habits slipped back in. But now you're at the point where you've had enough and you're ready to start feeling good again. In that little summary, you've picked out the jewels. You did have a group routine and you were really motivated. But then this happened, habits slipped back in, but now you're ready to start feeling good again. They get to look at all of those and go, oh, yep, yeah, that's pretty much it. I am really ready to start feeling good again. Summaries just cannot be underestimated in their power. If someone comes into you and they tell you a big, long-winded story, just by summarising it back, choosing a few key points, not the whole thing, they will be like, oh, yep, you totally heard where I'm coming from. And you can be sure that you're on the same page. A really fantastic thing that summaries do also is by collecting all the main points and pulling them together, they then provide a springboard for the conversation to move into the next stage. So you might summarise all the strategies they've tried so far, or you might summarise all the challenges they've faced and where they're up to. You might summarise the consultation and decide on next steps. Either way, you'll find that your client will repeat themselves less, and they will feel confident that the two of you understand each other and are at the same point because you've summarised. So when you're starting out with summaries, really it's about saying, okay, so let's see if I've got it all. Or from what you've said, it sounds like, or you might say, okay, so what I'm hearing is, and then you might contrast some behaviours and some goals. You might highlight the reasons you've heard that they want to change and the reasons that you've heard that they're struggling to put the behaviour into place, that their arguments to stay the same. You might demonstrate that you understand and then move the conversation forward. So summaries are just a group of reflections. So you really are using the same sort of strategies you use for reflections, but you're just putting a few of the key reflections together at once. So when we demonstrate active listening to our clients, we allow a deeper understanding. Our clients get the experience that we're really, truly listening to them and they feel valued and understood. Importantly, this invites them to trust us. And we know that once they trust them, they trust us, they feel safe to share. And then they have the opportunity to look at their behaviours, look at the patterns, and get a new awareness of what drives behaviour. And they also get to build self-efficacy, that true belief that they can do it. So the key takeaways are when we listen on purpose, we're using the skill of active listening. It's when we use more open questions that can invite our clients to start to talk about their reasons for change, and this evokes their insight. When we reflect their words, their thoughts and feelings, they feel heard, they feel understood, and they feel like we get them. We can use summaries as a way of highlighting their motivation and their ability for change, which helps them to feel more confident and helps them to see themselves as more than they perhaps think they are. We can also encourage and build confidence using affirming language, with that all-important you at the front. You must be proud. So, reflecting on our consultation from the beginning of the presentation, what would you like to implement into your consultations now? Is there an area of active listening that's really appealed to you and you'd like to work on? Maybe you're thinking about asking a few more questions to really understand where the client's coming from and what they need from you. You might be thinking about reflecting and summarising as a way of showing that you're really listening and that you get your client and where they're coming from. Maybe you're keen to try some affirming statements to build confidence. Whatever you're thinking of implementing in terms of communication with your clients, my encouragement to you is just start practicing. You might feel clunky at first and you might feel awkward, but it really does make a huge difference. And the more you practice, the better you get. This really has been a toe dip into the world of behaviour change and communication skills. So these communication skills are something that form a foundation for all of our behaviour change courses. And at Accredited Health Coaching Australia, we've got courses in behaviour change to help you become a behaviour change specialist. Now, if you're a health practitioner and you're just looking to get a toolbox of behaviour change skills so you can be more effective and you can support those ambivalent clients or the ones who are a bit stuck or maybe a bit pre-contemplative, then you might be interested in our Creating Change in 15-Minute Consults course. It's really aimed at short consultations where you might be limited with time. And what you'll get out of it with this toolkit is a way to be more effective, to help your clients get great results, and for yourself to find that you will also enjoy greater satisfaction in your role. Now, if you want to go a little bit deeper than that and you really want to implement a health coaching approach, then the health coach specialist teaches all of their foundational health behaviour change skills. At the end of it, you'll be able to integrate health coaching into your service offering. So whether you're looking at becoming a health coach or whether you're already a health practitioner and you're wanting to really change the way that you approach that client-centered consultation, then the health coach specialist will help you to really transform the way you communicate, the type of results that your clients get, and you will actually enjoy your role so much more because you're not going to be frustrated with your clients. You're actually going to be helping them to change. Then we have the Health Coach Mastery. So the Mastery is designed to build on the specialist course. So you learn the foundation skills in the specialist and then you learn how to really ramp those up to a mastery level in the Health Coach Mastery. However, some people have done quite a lot of study in behaviour change. Maybe they've done a lot of motivational interviewing or they might have done sort of a behaviour change weekend. And they're really looking to solidify what they've learnt and take it to the next level. So for them as well, they're building on those skills and they can join the mastery. They don't have to do the specialist. In the mastery, we have plenty of mentoring. You practice and practice and practice. You get feedback from your peers. You get feedback from the trainers. And at the end, there's an assessment to demonstrate that you can meet HECANSA's high level of requirements. And once you're complete, you can become accredited and insured to practice as a health coach. So HECANSA, or the Health Coaches Australia New Zealand Association, they set the standard for training and the standard for where health coaches should be in Australia and New Zealand. They've now brought in this international gold standard of competencies, and all of their approved courses, of which we are one, have to demonstrate that we can meet that high standard, and that at the end of doing our courses, you will be at the professional level of coaching. There's a few resources if you want to learn more. One is Health Coaching as a Lifestyle Medicine Process in Primary Care, that was written by myself and Siobhan Conn. There's also Motivational Interviewing Techniques, Facilitating Behaviour Change in the General Practice Setting, which is also a fantastic article. And I love the podcast on the GP show where Siobhan talked to Sam about how do we change patient behaviour. We would love you to connect with us. You can email us at info@accreditedhealthcoaching.com.au. You can jump on our website and take a look at the courses we've got and the other information we have there. You can follow us on Instagram, Facebook, or LinkedIn. So hopefully we will see you soon, and please be in contact if you have any questions.